Let's review the causes of weight regain after surgery. When I talk to patients who are struggling with weight regain following their bariatric procedure, the first thing I do is look at their weight loss curves or their weight curves, not just after surgery, but before as well. So what we typically find is that before surgery, as we approach the years before, that these patients were gaining oftentimes around 5 to 10 pounds per year. So you're on this trajectory of weight gain, and then you have the surgery, and there's this precipitous drop in your body weight. And this typically occurs over a period of about a year. Sometimes it can take 18 months, sometimes only 6 months, but a year is around the average time where we see about 95% of the weight that you're going to lose after surgery. And this really applies to sleeve patients, gastric bypass patients. The one group it doesn't really apply to is gastric band patients, but we're really not doing that procedure very often anymore. And then there's typically this what we call honeymoon period, where your weight remains stable and it's fairly easy to control your weight, and that can be actually a relatively short period of time, sometimes 6 months to a year with a sleeve gastrectomy, a little bit longer, usually in the order of 2, 3, 4 years in a gastric bypass patients, and then we'll start to see the weight starts to go up, and oftentimes we see these same 5 to 10 pounds per year. And so in order to solve this problem of why is this happening, why is the weight going up, we don't have to necessarily just look right here. We also have to look at what was happening here. Why were you gaining 5 to 10 pounds per year before surgery? Identify that and see, because most likely it's the same reason that you're gaining 5 to 10 pounds a year after surgery. So we have to be very systematic and thoughtful about this, and I always start with the weight gain that was occurring before you had your primary weight loss surgery. So this video really is to some degree a reboot of the video entitled Why Your Set Point Goes Up in nutrition course number 1. So nutrition course number 1, and there's a video for each and every one of these topics, goes over and identifies all of the reasons why people gain weight. And again, this is true before surgery, and it's the same rules after surgery. Surgery doesn't change things, with one important difference that we'll talk about in just a second. But the big three are where we're going to focus in this course on medications, processed foods, and inactivity and injury. These are far and away the most common causes of weight regain that I see in my practice, and that's really where I start when I'm looking and evaluating patients who are struggling with their weight in the years following surgery. Some other things are pregnancy and menopause. We certainly do see some pregnancy after surgery, and as well as some menopause, but the truth is these are generally unavoidable events. Genetics is something that kind of comes off the table initially, but what we find is that there's a variance in the genetic response to surgery. Some people have a really strong and positive response to surgery. Other people have not so positive. Those patients who have a great initial response will be more resistant to weight regain than someone who really has kind of an average or below average weight loss response. The same yo-yo dieting, I still see this after surgery frequently, and reeling this in and kind of getting you off of this fad diet cycle that you've spent your entire life on is really important for success. Stress and depression and other causes, really the number one cause that's listed in other is sleep or lack of it, and it's the night shift worker who I worry about the most. I believe working the night shift puts you at a significant risk of weight regain after surgery, and I urge all my postoperative bariatric patients to do whatever they possibly can to get off the night shift. It's not always possible, but if you can swing it, that's going to be helpful. So the cause that we don't really see before surgery, of course, is surgical failure. And this is a really important concept that's difficult for a lot of people to understand. But I think it's critical that we discuss it before surgery and then of course after surgery as well. Because these surgeries work primarily by changing the hormonal state, which adjusts your set point to this lower level and increases your metabolism and decreases your hunger to bring your weight down to your new set point, like we've discussed primarily in nutrition course number 1, but also in all of the other discussions we've had about surgery. We have to look at these surgeries as different. See, most people still continue to look at these surgeries as this anatomic or almost punitive treatment. If I have this surgery, then I can't eat or I'll throw up. Almost like eating too much, I should be punished for that, and throwing up is my punishment. And so people kind of look at it like almost there's this anatomic blockage that just prevents you from being able to eat, and as long as you just can't possibly eat, almost like having your jaw wired shut, then this will cause the weight loss, and as long as you can just never really eat a lot anymore, you're going to be fine and you're going to maintain the weight. And then when you start to notice that you can eat more, we rationalize this and say, well, my stomach must have stretched out, and this must be an anatomic stretching that's undesired, and it must of course be my fault because anything related to my weight is always solely my fault. I must have overeaten and stretched it out. That's the typical way of thinking about what's happening in these changes after surgery. If you've watched the videos about the honeymoon years and then the end of the honeymoon years, you'll recognize that it's much more complicated than that, and it's really much more of a shift in your hormonal state that's driving these changes after surgery, and quite frankly, just an adaptation to surgery. The natural result of these surgeries is that you will be able to eat more over time. That happens in 100% of all patients. So if we're going to look at these surgeries not as this anatomic punishment that blocks you from eating or blocks you from absorbing calories, but instead as this some kind of almost this mystery that causes these shifts in your hormones, then we have to look at it a different way. In many ways, weight loss surgery almost works like a medication. The surgery, the anatomic change in the surgery by diverting food away from a segment of the stomach and delivering it at a less processed state, more toward the middle of the intestine like we see in a gastric bypass, that these anatomic changes trigger these hormonal shifts, almost as if you gave a medication that did the same thing. We don't have that medication, but the surgery themselves almost act that same way. And if we think about these things as acting more like medications, then we have to look at them and with the same scrutiny that we look at all medications. If someone was to go to their doctor for high blood pressure and they took a pill and it initially caused their blood pressure to come down and they had a really good result, and then over time their blood pressure creeped back up, even though they still took that pill, we would all understand that. We'd recognize that, hey, this is a complicated disease, and over time things will change and adjust, and that pill may not work as well anymore. We also understand that you may go to the doctor and be placed on the same pill as your neighbor, and you take the pill and it works like a charm, and your neighbor takes the pill and it doesn't lower their blood pressure at all, because there's a variation in the efficacy from one patient to the other. We see this with surgery. We see some people lose more weight than others. We see some people struggle with weight regain. And with these surgeries, they have a lifespan, and over time they stop working as well. And that's where the lifestyle changes become critically important. But it may be that the lifestyle changes that are necessary for you to maintain that body weight may be almost impossible for you to maintain, and the inevitable result is some regain of your weight that you've lost. And we see more surgical failure. The gastric band has the highest rate of weight loss failure, followed by the sleeve, followed by the gastric bypass, followed by the duodenal switch. And again, what we see, it's directly proportional to the amount of weight you lose. So we have to look at these therapies as basically, as we're moving this way, we're increasing the efficacy of the therapy. It's a stronger pill, if you will. And when you give someone a stronger pill, it's going to last for a longer period of time. So recognizing that these surgeries, because they work on your hormonal state, not on the anatomic layout of your GI tract, they're going to work more like medications and have variable efficacy and variable durability throughout time. And over time, it can get harder and harder to maintain the weight that you've lost. This does not mean that you're going to regain all of the weight that you've lost. It just means that over time, often these surgeries do not work as well as they did from the beginning. And this is an important thing that we have to recognize, understand, and accept. These are imperfect treatments for obesity. I wish they were better. They're pretty good. In fact, they're certainly the best thing we've got going right now. But they are imperfect and they do not work forever, and there is some element over time of surgical failure. So the bottom line is that the first step in treating weight regain is identifying the cause. The big three, which are medications, processed foods, and inactivity and injury, should be heavily scrutinized, making any adjustments, and recognizing that there is some degree of surgical failure, which often will require treatment with a revisional surgery, may be necessary.